Now we're looking at the posterior thigh. Specifically, we'll look at the hamstrings musculature. And on the medial and lateral side, we have two pairs, or a pair on each side. And on that lateral aspect, stacked on top of each other, we have the long head of the biceps femoris. Deep to that, we have the short head of the biceps femoris. Moving over medially, we have the semitendinosus. You can make out that longer tendon down here. Deep to semitendinosus, we have semimembranosus. And the long head of the biceps femoris, semitendinosus, and membranosus, they're all considered true hamstring muscles because, as you can see, if we follow these three up, they're all going to converge onto a tendon that locates where they originate from, which I can feel. I'm pushing my finger against a bony feature here, which would line up with that ischial tuberosity on the inferior part of the hip bone. So that tells us that they have an action at the hip. Whereas if you go back to that short head of the biceps femoris, if we follow it up, notice it doesn't follow the rest of those hamstring muscles. It's going to originate from somewhere on the femur. Okay, so in terms of function, all hamstrings, if we follow it down, they'll all cross the knee joint. You can follow the tendons down, cross the knee joint in the lateral and medial sides. So when the hamstrings contracts, we'll get flexion of the leg at the knee joint. And at the hip joint, the long head of the biceps femoris, semitendinosus, and semimembranosus will give us extension of the thigh or trunk at the hip.